Hormone pellet therapy isn't for everyone, and not everyone who undergoes hormone pellet therapy ends up leaping tall buildings with a single bound. What can go wrong with hormone pellet therapy? In no particular order, I'm going to list several of the possible complications from this treatment. First of all, you can experience what is called extrusion, otherwise known as rejection. Once in a great while, a patient will notice the pellet implant site starting to become warm or red or tender. If this happens, this needs to be addressed immediately because it could be a sign that your body is trying to reject the pellets. We want to jump on it right away to block that attempted rejection. If the rejection occurs, you will notice that pellets will burn a hole right through your skin and your body will spit the pellets out one at a time. Our incidence of extrusion dropped dramatically so that now it's down to maybe once a year. When we switched to proprietary pellets that have a special formulation that help block this problem. Now, for those patients who still experience an extrusion notwithstanding, often it's the result of overexerting themselves before they're supposed to, or their immune system seeing this wad of testosterone and saying, I recognize testosterone because it's part of the human body, but this big wad of it, I don't like it. And so it can spit it out. If that's the case, then we need to work on your immune system so that it no longer attacks something that is a native part of the body. A second thing that can go wrong with hormone pellet implantation is infection. Infection looks very similar to extrusion, except for two things. The body does not tend to spit the pellets out through the skin, and secondly, it does not respond to the treatments that we use for extrusion. It requires antibiotics. Infection is extremely rare when the procedure is performed properly by a qualified professional. In fact, I can't remember the last time I experienced an infection. But it does happen, and it is a risk because it is a minor surgical procedure, and as with any surgical procedure, there is the risk of introducing bacteria into the body. A third risk is getting too much estradiol or testosterone. This is not terribly common. When it does happen, in the case of testosterone, it can cause increased aggressiveness or irritability or hypersexuality, a desire to want to have sex all the time. Again, pretty rare because we are conservative and avoid the higher doses that would tend to lead to this complication. However, because everyone is different, what is a low dose for one woman can actually be too much for another. The next risk is not getting enough of a hormone. When this happens, usually an individual will notice some benefits from the pellets during about the first 4 to 6 weeks, and then the benefits subside. That's when we know, in combination with the 1-month labs, that this particular dose was not high enough for that individual. And in that case, what we want to do is implant again as quickly as possible so that we can get their plateau phase into a higher plane and enable them to experience the benefits of the pellets long term. The next complication I want to talk about is no effect at all. In other words, you come back to your 2-month appointment following your pellet implants and say, I don't feel a thing. Typically, this stems from having receptor dysfunction, meaning the signal in terms of the hormones is there and it's bathing every cell, but the receptors on those cells are not receiving the signal. Typically, this stems from toxicity and requires a little detour to work on detoxification. The good news is, if you have toxicity that's impairing your responsiveness to hormones, then that toxicity is going to be affecting a lot of other aspects of your health. And therefore, when you detoxify properly and fully, then you will benefit in numerous ways. Another cause of lack of effect of hormone pellet implants and of any hormone replacement for that matter, as several of these complications relate to any hormone replacement method, is HPA axis dysfunction. This is where the connection, the signaling between the brain and the adrenal glands is not functioning the way it was designed. And when that happens, your responsiveness to any hormones, whether they're ovarian, testicular, or other hormones, is going to be impaired because all hormones depend on an intact HPA axis. In women, the next thing that can go wrong is the development of random isolated facial hairs, some acne outbreaks, oily skin, and or loss of hair from the top of your head. This stems from an enzyme in your skin called 5-alpha reductase. We all have this enzyme in our skin. The problem is that some of us have more than others. When a woman in particular has facial hair or acne or hair loss even before she starts hormone replacement, then we know she's got a problem with 5-alpha reductase. In this case, or if at any point in her hormone replacement journey she discovers the development of one or more of these symptoms, then we use proprietary pellets that contain a blocker in the proper ratio that inhibits or turns down that enzyme in the skin so it doesn't have the same effects that it does when it's fully operational. The next complication that some women will experience is vaginal bleeding. This stems from a number of possible causes. Of course, the one we worry about is cancer. I have yet to experience a woman who is being treated with hormone pellet implants developing uterine cancer. And the reason for this is very simple. Because we never use unopposed estrogen, we always balance it with oral progesterone. With that said, some women will have endometrial cancer before they start hormone pellet implants or any form of hormone replacement for that matter, and will not know it because they're not bleeding yet. And then they start hormone replacement therapy and then start bleeding, and then we evaluate it and find that they have uterine cancer, which is a good thing because now we've detected it sooner rather than waiting until their body naturally started developing the symptoms. But again, I have yet to see that in a woman who was treated with hormone pellet implants and did not already have uterine cancer. The far more common causes of vaginal bleeding are a mismatch between progesterone and estradiol in the uterine lining. These two hormones balance each other out in the uterus, and so this is why we always use them together. And so this is another rare, in our experience at Prestige Wellness Institute, cause of vaginal bleeding. A more common cause is uterine fibroids or polyps. These are growths that tend to occur in women who are estrogen dominant. And typically women who are estrogen dominant have been dominant for a period of decades. And it only becomes manifest when they start hormone replacement. If you have endometrial polyps or fibroids, unfortunately there's no amount of progesterone that can balance that out because these are fed by estrogen. So your alternatives are to stop receiving any estrogen whatsoever, treat your uterine lining with endometrial ablation, a procedure called embolization, take a combination of natural agents that counteract estrogen dominance and shrink the fibroids, or remove your uterus. I'm never one to recommend surgery except as a last resort when we have no other options. In this case, some women just cannot control their bleeding without having their uterus removed. While it is an option simply to permanently forego estrogen, it's not a smart one. The reason it's not a smart one is because estrogen is critical for prevention of both osteoporosis and dementia. And these two conditions are significant causes of morbidity and death in women today. So this is not, in my opinion, the best option. Now, the last thing I want to say about what can go wrong with pellets, and this applies again only to women, is breast cancer. You can develop breast cancer while undergoing hormone replacement with pellets or any other form. However, it is not from the pellets. There is no evidence that bioidentical hormones properly balanced contribute to the development of breast cancer. In fact, there's actually excellent evidence that demonstrates a dramatic reduction in risk of breast cancer with bioidentical hormones in general and hormone pellets in particular. In fact, the evidence is far greater for protection from pellets than from any other form of hormone replacement therapy. With that said, there are many doctors who are still misled by the very misunderstood Women's Health Initiative studies that were published in 2002. And they still think that bioidentical hormones cause breast cancer. What they do not understand, because they obviously did not read the studies, is that the Women's Health Initiative did not study bioidentical hormones. And even less, they didn't study hormone pellet therapy. They studied two drugs. One, Premarin, which is a combination of horse urine estrogens, and incidentally, humans do not make horse urine estrogens, and Provera, a drug otherwise known as medroxyprogesterone acetate, which also is not a human hormone. It is a chemical made in a laboratory that does not have the chemical structure of progesterone that your body used to make. So let's put this one to bed. Hormone pellets do not cause breast cancer. If you get breast cancer while under treatment with hormone pellets, you already had it. In fact, keep in mind that it takes 8 to 10 years of doubling time for cancer cells to become large enough in terms of tumor size to become detectable on a mammogram, ultrasound, or MRI. And so breast cancer has been developing for a number of years before we ever detect it. There are a number of true causes of breast cancer that could be the topic of a different video that do not include hormone pellet therapy. In conclusion, before you undergo hormone pellet therapy with any practitioner, you should be aware of all the risks and talk over with that practitioner their specific experience with those risks. How often does this occur, and what do they do about it? How do they handle those problems? After hearing all that I've just told you, you might think, why would I ever want to expose myself to all of these possible problems? Well, I guess you need to talk to some of our patients first, because we have a lot of patients who would rather die than stop getting hormone pellets.